I'm Teresa Coraggio, and this is Third Paradigm. Today I'm talking about another heavy topic, the Cancer-CoVax Connexion. And I promise that after this, I'm going to do a couple that are light and fluffy, like my daughter's favorite bread. First, I want to talk about the last episode, which was Forgiving Hitler, and follow up on some things. I have often said that I would go to the ends of the earth for a real conversation. And now I find that real conversations are coming to me from the ends of the earth. And they're conversations where I get to put all of my thoughts on a topic in order and speak without interruption, and then have someone give a concise and well-articulated response to that, like Lindsay McPherson did in talking about forgiveness and that concept and the glossy brochures of the official narratives, which is a phrase I love. Lindsay is also the person who gave me the phrase socio-spirituality. Now, Jack Sirius gave a bunch of different quotes that were really great in response, and then wrote "Wall meets spaghetti." And in one of those, he said that he felt that I really came into my own when I was talking about the nature of reality, or the reality of reality. And so I'm thinking that I'm just going to lean into that, because as far as I can tell, there's not someone who's doing that exact connection. I think this is my niche. And so I think maybe it's the reverse, and that what I start with is the spiritual, is the big picture of what is ultimate reality, and then work down to the psychology and what it is that's going on in our responses to things, and from there go to the social and what's happening in the world, and what's the role that we can play in responding to it. So that's the approach that I'm going to be taking here. Let's take the reality triangle that I talked about in the last episode and apply it to cancer. That reality triangle says that there are only three possibilities for ultimate reality. 1, God is evil. 2, evil is God. And 3, the world and evil do not exist as we perceive them. If you aren't willing to consider the third one, you do need to decide which of the other two you believe is true. Now, there are plenty of God apologists who will say that everything good is because of God and everything bad is because of us. But that makes no sense if we were created by God. So if you look at cancer and you say, how does this make sense? You either have to say God is cruel, or you have to say there is no God and the world is cruel. Or you look at that third possibility, and that's what is presented in A Course in Miracles. To go back to the second option, that evil is God, the way I define to do bad is to inflict suffering, and to do evil is to cause others to inflict suffering. If we are bodies, then the ability to cause pain is the most powerful force in the world. Violence is what rules. Violence is king. In order to believe that that's not true, you have to entertain the possibility that we're not bodies. Now let's look at the psychology and the difference between magical thinking and miracles. What I know from my hospice experience, and also my daughter as a bereavement counselor, that when someone has a life-threatening situation, what they do is get very obedient. There is a trust in authority. There's a sense of, if I follow the rules, if I just make sure that I'm doing exactly what I'm told, this is going to be okay. And that is a form of magical thinking, because it's saying, I'm going to do this ritual, and this ritual is going to turn out okay. And at the same time, there's another type of magical thinking that Barbara Ehrenreich, who I once had the pleasure of interviewing and who thought that my interview was one of the most fun she had done, has written this book, Bright-Sided, which is about the dark side of positive thinking. That when we think that we have power, and that if we think the right thoughts, that then we can affect the outcome. In one way, we're acknowledging what's true, which is that the mind does have power over the body. That in A Course in Miracles, the body doesn't even exist. It's all a dream. And so the mind has complete control over the figures in the dream. But that's been twisted in this psychology to make it where the mind is controlling the body. And in a dark way, in a way that has turned on it and is making it suffer and is causing that cancer in the first place, but then can be used in order to cure it. The difference with the miracle, as I understand it from reading the Course, is that there's no attachment to the outcomes for one particular figure in the dream, because that figure isn't yourself any more than any other. Now, it also does not say that suffering is something that is part of that. It's not about sacrifice. It's about recognizing that there is a choreography to the dream that is going to turn out the best for everyone, and that everyone includes you and that figure with which you identify. And so rather than looking at how can I control this outcome, it's saying, what does this mean? What is this leading me towards? How is their purpose? How can I respond to especially things that I have no control over, and figure out what my move is in this dance? One way of looking at magic is that it's asking to be an exception. It's asking for a God that you are special to, who is going to change things because you're on that list. Or it's asking for some special power that you have that's going to turn things around. The miracle is looking at inclusion. Is it saying, I'm not going to be afraid, and I'm going to be willing to be an example to other people that they don't need to be afraid either. And that's something that I don't personally ever want to experience. And those people who are trying to find someone else's meaning and tell them what the meaning should be in their life-altering experience should be resigned to the seventh circle of hell. That's not what I'm talking about. You can only ever find your own meaning. And so for me, I can look at something and say, okay, what's this telling me that my role should be in this? But I can't ever decide what someone else's role should be, because then I would be redundant with them. They would have no reason to exist because I already have the answer. I don't have the answer. That's why they have the question. Why is the question of whether evil is God so important to the present moment? What I learned from reading Robert F. Kennedy Jr.'s book, The Real Anthony Fauci, is that people didn't die of AIDS. They died of AZT. And we know that people who are hospitalized with COVID don't die of COVID. They die of remdesivir. And anyone working in hospice can tell you that people don't die of cancer. They die of chemo. So the best case scenario is that they just want your money and they could care less whether you live or die. But the worst case scenario is they want your life and the money is just a side hustle. I think that's something that we need to be able to look in the eye and to look it in the eye without fear. Because if the ability to impose suffering is the greatest force in the world, because there's really nothing else that exists to oppose it, then we're pretty screwed, because there's never been such a concentration of power before that has been so utterly ruthless. And I have come completely along this journey to say that I no longer think these are just sloppy pharmaceutical profit decisions. That I think that the agenda of the Great Reset is dispossession through loss of home ownership and small businesses, and depopulation through raising the death rate and lowering the birth rate. How does this relate to the CoVax? Because of a personal situation with someone who is the picture of health, who was suddenly diagnosed with stage 4 pancreatic cancer, I put the question out to my networks, and the answer has come back in droves. That I think initially with the vaccine, there was neurological and cardiac effects, but there's been enough time where now the cancers are coming through. And there's a Danish director of pathology, I think it is, who says that they're turbo cancers, that she has never seen tumors that are as big or in as young of people or that have grown so quickly. And that people whose cancers were in remission have come back with a vengeance. My understanding of the science of it is that there's an ingredient called pseudouridine, which is an immune suppressant. And so what would typically block and keep those cancers from growing and metastasizing has now been suppressed. And so we're seeing this surge of cancers that are rare, that are happening in people where they've never come up before. In the course of doing my research, though, I listened to an interview that Dr. Joe Mercola did with Dr. Nathan Goodyear, who is both a medical doctor and also a holistic practitioner in Scottsdale, Arizona. And he runs a cancer clinic which specifically uses very high dosage intravenous vitamin C combined with hyperthermia and raising the body's temperature so that it saturates the tumors. And then also high dosage melatonin and an anti-malarial, and has a residential program that has shown really, really good results. Now, if it were me, there's no question in my mind that that's what I would do, because it heals the body to heal rather than, as he says, destroying to heal, which has never made sense to me. And it's a program that just seems like it could really turn things around, and that our learning that the healthcare industry is not on our side could be something that creates a turning point in how we look at our health in a completely different way. How is intravenous vitamin C and hyperthermia different from magical thinking? Well, personally, I prefer my magical thinking to have good data behind it, because I just can't be fooled that easily. So if I'm going to believe in magic, I want it to have numbers and facts. But also, if we can turn this around and show that there are ways of turning away from the death spiral that is our current healthcare industry, and instead have holistic therapies that are taking into account the whole person and that are doing it with love and with care. I think that we can stop the trajectory in its tracks, and that we can end the way that the food industry, that healthcare, that the economic factors, all of those are things that we, I believe, can take back and control if we use this moment. And that, to me, is a miracle. And to hold true to my promise of a little more light and fluffy, here's what's the best that can happen. And this is Tony Robbins is working too hard and aiming too low. Thank you for watching to the end, and please check out the comments on both YouTube and Substack because you are a wonderful community.